Hello everyone, welcome back to my channel. Today is Thursday, May 9th. Hope everybody's having a good week. Sorry I didn't do the paper this week again. I'm just not into it. Haven't been feeling well, and you know how it is. And I really don't like to disappoint, which is why I don't even bother dating anybody anymore, because it's just full of disappointments when you're dealing with today's topic, fibromyalgia. Well, coffee with coconut oil gives me energy. Funny. Okay, I'm going to start with what it is and what it isn't. Now, this is written by two doctors who have it, so they know what they're talking about. I'm going to try not to be negative, and I'm going to try to make it not so long that it won't upload, like the last one I just did. Okay, before you read this chapter, a word of warning. Having fibromyalgia syndrome, FMS, is no fun. You know that already, but reading about it shouldn't depress you. Fibromyalgia is neither progressive nor deadly. There are many things you can do to improve the quality of your life, and you'll learn about them in this book. We both have FMS, they're talking about the doctors here, and we've learned how to take control of our lives as we hope to teach you how to take control of yours. Whatever your previous experience with FMS has been, you are no longer alone. The best place to start is to describe what you may be experiencing in your body and mind. What's in a name? Fibromyalgia syndrome. That's my hand. Yeah, it's pronounced fibromyalgia syndrome. The word fibromyalgia is a combination of Latin roots fibro, connective tissue fibers, my, muscle, al, pain, and ja, condition of, which is why they should really rename it, in my opinion. The word syndrome simply means a group of signs and symptoms that occur together which characterize a particular abnormality. FMS is not a new syndrome. It was first described by William Balfour, a surgeon at the University of Edinburgh in 1816. But for many years, the medical profession called it many different names, including chronic rheumatism, myalgia, pressure point syndrome, and fibrositis. And the condition was also thought to be psychological by some physicians. I think actually my grandmother had fibrositis, if I'm remembering correctly. Note that FMS is not the same as myofascial pain syndrome, which is discussed in chapters 3, 4, and 5. In other words, the prevailing belief was that it was all in your head, or it was your own fault that you were sick. In 1987, the American Medical Association recognized FMS as a true illness and a major cause of disability. Now, nearly 10 years later, it is still, unfortunately, too often dismissed as the newest fad disease, and most physicians still lack the diagnostic skills needed to differentiate it from other chronic pain conditions. In fact, until recently, it was rare to find a doctor who had even heard of FMS as a real condition, and very few doctors have received any substantial training in treating the syndrome. Many physicians are defensive about their lack of training in this field, and there are some who still refuse to acknowledge that FMS and MPS really exist. You may have encountered such practitioners. Fortunately, this attitude is becoming less common. When I was diagnosed by a very competent doctor, who also diagnosed me with Meniere's disease about 6 years before that. No, I'm sorry, 16 years before that. I was going for trigger point injections 3 times a week just to get through my work week. And here comes the cat again. He likes to make a show, I guess. He likes to make an appearance. Let them see your pretty face at least. Come on. Take a hike. Ta-ta now. Sorry. So, anyway, it's kind of hard to get a diagnosis. Not that I didn't even know what he was. I had no idea what he was talking about when he first diagnosed me. Anywho, okay. Aiming for a diagnosis. The average FMS patient suffers for 5 years and spends thousands of dollars on medical bills before receiving an accurate diagnosis. As a result of misdiagnosis, more than half of all patients undergo unnecessary surgery. It isn't unusual for those who are fibromyalgia patients to feel a profound sense of relief when they learn they have a recognized illness and they come to understand that it isn't progressive. If this has been your experience, you may cry with relief as at not having to doubt yourself any longer. At last, someone believes you and believes in you. You really do have these symptoms, and you are no longer fighting the world alone. Debilitating self-doubt can be replaced with appropriate self-care. And I don't want your butt in my face, thank you. Admittedly, if your doctor has no specific training in FMS, his or her initial diagnosis can be extremely difficult. Patients come in with very different symptoms every visit, which often do not appear to be related to each other. These can run the gamut from sleep problems, blurred vision, falling, itching, and pelvic pain to hearing loss and soft tissue aches and pains. The list sometimes seems endless. Many patients don't even tell their doctors all of their symptoms because they sense the doctor's disbelief. If you only knew. Our culture expects its physicians to know all and see all, which is a recipe for trouble for both doctor and patient when the illness presents as complicated a diagnosis as FMS does. With FMS, the standard medical tests can come back negative, and the doctor can become very frustrated. The patient may look fine, but he or she has constant unsubstantiated complaints. To make things even more confusing, the signs and symptoms can, and frequently do, fluctuate from hour to hour and day to day. My ex-fiance knew what I went through. He was there on a daily basis. You know, he helped me a lot. I have to say that. Yeah, he saw how I lived my life. Yeah, it's very hard because I was, 40? I was 40 years old. 41. When you can't do what you want to do, when you can't go on a date because you just feel horrible. You know, it's not fun. Anyway. In desperation, many doctors often send their patients to physical therapy or for psychological counseling. Yet, most often, every treatment a person with FMS tries only aggravates the symptoms further. It is important to understand that FMS is not a catch-all, wastebasket diagnosis. FMS is a specific, chronic, non-degenerative, non-progressive, non-inflammatory, truly systemic pain condition, a true syndrome. Very recently, however, the National Institutes of Health have reclassified it as a true disease, but most authorities today still say that technically FMS is not a disease. Diseases have known causes and well understood mechanisms for producing symptoms. Instead, FMS is called a syndrome, which means it is a specific set of signs and symptoms that occur together. Don't let this categorization fool you into thinking that fibromyalgia is any less serious or potentially disabling than a disease. Rheumatoid arthritis, lupus, and other serious afflictions are also classified as syndromes. The essential symptom of FMS is pain, except in the case of elderly patients. Older patients are more troubled by fatigue and depression. In younger people, discomfort after minimal exercise, low-grade fever, or below normal temperature and skin sensitivity are also common. Yes, yes, and yes. Laboratory tests for fibromyalgia are valid only to rule out other conditions. As this book goes to press, there is still no blood test that can accurately identify fibromyalgia. I'm not going to go into all of it because it's too long. All right. The official definition of fibromyalgia came about as a result of the Copenhagen Declaration, which established fibromyalgia as an officially recognized syndrome on January 1st, 1993, for the World Health Organization. This definition was presented at the Second World Congress on Myofascial Pain and Fibromyalgia, which was held in Copenhagen in 1992. The Copenhagen Declaration defines FMS as a painful but not articular, not present in the joints, condition predominantly involving muscles, and as the most common cause of chronic widespread musculoskeletal pain. The diagnostic fine points of FMS have been defined by the American College of Rheumatology. The World Health Organization considered the ACR definition as suitable for research purposes and added the following symptoms to the syndrome. Note that these are often overlooked. The presence of unexplained widespread pain or aching, persistent fatigue, generalized morning stiffness, non-refreshing sleep, and multiple tender points. Most patients with these syndromes have 11 or more tender points, but a variable proportion of otherwise typical patients may have less than 11 tender points at the time of examination. In addition, the Copenhagen Declaration states that fibromyalgia syndrome is part of a wider syndrome encompassing headaches, irritable bladder, dysmenorrhea, cold sensitivity, Raynaud's phenomenon, which is, I don't know if this will show up on camera, but you see the splotching? And then my fingers are usually always darker than the rest of my hand. I don't know if you can see that. See my fingertips? Anyway. Where was I? Raynaud's phenomenon, restless legs, atypical patterns of numbness and tingling, exercise intolerance, and complaints of weakness. Note, here the document appears to be referring to FMS-MPS complex, which consists of fibromyalgia complicated with myofascial pain syndrome. Myofascial pain, MPS, will be explained and discussed in Chapter 4 and 5. The Copenhagen Declaration goes on to state that the psychological state of FMS patients, which is often one of depression and anxiety, could well be caused by the physical conditions. Caused by. Chronic pain, especially pain of undiagnosed origin, is a frequent source of depression and anxiety. Okay, these are the tender points. Bring it in for an up close. Okay. Looking at the facts. Knowledge, as they say, is power. This is especially true with fibromyalgia syndrome. The more you know about it, the better able you will be to deal with it. FMS can occur at any age. Most patients, when questioned carefully, reveal that their symptoms began at an early age. Often the first sign is growing pains. Yeah. I had growing pains, that's for sure. Plus I was hit by a car, which didn't help any, I'm sure. Pain is frequently the most prominent symptom of FMS, but there are many others. For example, your eyes may often be too dry, but at other times they will water. Your thermoregulatory system is out of whack, which is why I cannot handle heat. I get very, very hot. I feel like I'm baking. You may notice this thermal fluctuation when you get out of bed, often due to bladder irritability during the night. You may have to wait, about 5-6 times a night. You may have to wait for your temperature to cool down after getting back in bed before you can pull the bed cover up again. Oh yes, and with the tingling in my feet, which is neuropathy, yeah, it's fun. Another symptom of FMS is spasticity, tightness, which can constrict the peripheral blood vessels, those close to the skin. This symptom, especially in winter, makes certain parts of our bodies, most often the buttocks and thighs, feel like cold slabs of meat. You may experience skin mottling, like I just showed you, although you can't really tell. I don't know if you can see it on camera or not. And nail ridges. Fingernails can break off, often in crescent-shaped pieces. Yes, this is about as long as my nails will get, and they'll break right at the nail bed, and they'll break all the way around the nail. If nails do grow, they sometimes start to curve under, which this one does. I don't know if you can see it, but often FMS is found coexisting with one or more other disorders, and FMS may also amplify the symptoms of another disorder. Now, I have Meniere's disease, I have osteoarthritis, I have paroxysmal atrial tachycardia, degenerative disc disease. The list goes on and on and on. And I hate it because I feel like I'm complaining. This is why I don't talk about it much, because I get depressed, because there's nothing that can be done. The medications don't really help. I was on medications for years and they really didn't help. Actually, the antidepressants made me more depressed. And that's the first thing they try is antidepressants. Yeah, there's a multitude of other things that are wrong with me. But I still have a sunny attitude and disposition. Often FMS is found coexisting with one or more other... Oh, I read that. FMS adds stress to everything we do. Many fibromyalgics cannot sit still or maintain any other position for longer than 20 minutes without becoming stiff. Morning stiffness can take an hour or more to wear off. The course of FMS can be mild and moderate or severe. In some cases, there are remissions. Nearly everyone with FMS exhibits reduced coordination skills and decreased endurance abilities. FMS can be as disabling as rheumatoid arthritis. Approximately 30% of FMS patients cannot hold down their jobs due to their chronic unrelenting symptoms. It often creeps up one symptom at a time. The person with FMS learns to live with those symptoms until his or her quality of life becomes seriously compromised. You know what I forgot? I skipped somehow. The TMJ, or maybe was that on the other thing? Anyway, it often... I have it's called TMJ disorder, temporomandibular joint disorder, which is your jaw. My jaw cracks when I open my mouth too wide. For years, for decades, it's been doing that. I also started with, I don't know where, that might have been this paper. Oh, it is this paper. I also had, what do you call it? Migraines for years. Anyway, I'm going to just read this a little bit, and then I'm going to go on to that other paper there. FMS is a sensitivity amplification syndrome. Because of this, it has been called the irritable everything syndrome. This means that fibromyalgics are sensitive to smells, sounds, and lights and vibrations. The noise emitted by fluorescent lights can often drive them crazy. FMS sensitizes nerve endings, which means that the ends of the nerve receptors have changed shape. Because of this, for example, your body might interpret touch, light, or sound as pain. Your brain knows pain is a dangerous signal, an indication that something is wrong and, needs attention, so it mobilizes its defense. For example, adrenaline starts pumping and your muscles tense, ready for a fight or flight action. Your heart speeds up, blood flows slow to areas that are immediately needed for action, such as your digestive tract, but blood flow to your muscles increases. Then, when those defenses aren't used, or when no action is taken, the body-mind system becomes anxious. Frequently for fibromyalgia, the pain does not indicate a dangerous situation, but our bodies are getting wrong signals Pain itself causes stress and depression, which may cause further contraction and then more pain. The pain signal is an indication that it's time to do something about the problem. Sleep plays a crucial role in FMS. Perhaps you aren't getting enough sleep or the right kind of sleep. You may have insomnia or a host of other sleep-related problems. See Chapter 10 for sleep for information about sleep disorders and what you can do about them. Okay, that's enough from this book for today. If you want more, I will read more for you another day. Now this, I asked my doctor because, they have this booklet for Meniere's disease. I could have sworn I saw one at the neurologist's office. So I had asked them for this at the desk, and they printed this out for me. This is from the Mayo Clinic. Okay. Fibromyalgia is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain processes pain signals. Symptoms sometimes begin after a physical trauma, surgery, infection, or significant psychological stress. In other cases, symptoms gradually accumulate over time with no single triggering event. Women are more likely to develop fibromyalgia than are men. Many people who have fibromyalgia also have tension headaches, temporomandibular joint disorders, irritable bowel syndrome since I was a kid, anxiety and depression, migraines since, I was in my 20s. While there is no cure for fibromyalgia, a variety of medications can help control symptoms. Exercise, relaxation, and stress reduction measures may also help. Symptoms include widespread pain. The pain associated with fibromyalgia often is described as a constant dull ache that has lasted for at least 3 months. To be considered widespread, the pain must occur on both sides of your body and above and below your waist. Fatigue. People with fibromyalgia often awake tired even though they report sleeping for long periods of time. Sleep is often disrupted by pain, and many patients with fibromyalgia have other sleep disorders such as restless leg syndrome and sleep apnea. Yes, sleep apnea. And probably restless leg syndrome as well. Cognitive difficulties. A symptom commonly referred to as fibropog impairs the ability to focus, pay attention, and concentrate on mental tasks. Fibromyalgia often coexists with other painful conditions such as irritable bowel syndrome since I was a kid, migraine, and other types of headaches since I was in my 20s, interstitial cystitis or painful bladder syndrome, temporomandibular joint disorders since I was in my 20s. Yeah, I'm thinking in my 20s. I think it was diagnosed right around the time that I had Meniere's disease. I just took it as normal. My jaw cracked when I opened my mouth. So, can't eat bagels or chew gum. Can't eat bagels because of sodium anyway. Okay, causes. Doctors don't know what causes fibromyalgia, but it most likely involves a variety of factors working together. These may include genetics. Because fibromyalgia tends to run in families, there may be certain genetic mutations that may make you more susceptible to developing this disorder. Like I said before, I think my grandmother had fibromyalgia, but they diagnosed it as fibrositis. Infections. Some illnesses appear to trigger or aggravate fibromyalgia. Well, I've had a bunch of childhood diseases. I had measles, regular measles at 5. I had German measles every time they came around. I had chicken pox. I had mumps. You name it. Pretty much I had, except the real serious ones, Physical or emotional, plus ear infections left and right. Physical or emotional trauma. Fibromyalgia can sometimes be triggered by a physical trauma, such as a car accident. Psychological stress may also trigger the condition. Why it hurts. Researchers believe repeated nerve stimulation causes the brains of people with fibromyalgia to change. This change involves an abnormal increase in levels of certain chemicals in the brain that signal pain, neurotransmitters. In addition, the brain's pain receptors seem to develop a sort of memory of the pain and become more sensitive, meaning they can overreact to pain signals. Risk factors for fibromyalgia include your sex. Fibromyalgia is diagnosed more often in women than in men. Family history. You may be more likely to develop fibromyalgia if a relative also has the condition. Other disorders. If you have osteoarthritis, yes, I do, rheumatoid arthritis, or lupus, you may be more likely to develop fibromyalgia. The pain and lack of sleep associated with fibromyalgia can interfere with your ability to function at home or on the job. The frustration of dealing with an often misunderstood condition also can result in depression and health-related anxiety. Yes, yes, and yes. I don't have a life. I'm in bed every day, 8 o'clock. I blame it on the birds sometimes because I don't want to make noise because the birds awake, but in reality, I don't have the energy. I just don't have the energy to stay awake. I don't even want to be in a relationship anymore ever again because people don't understand. You don't look sick. You really don't. But you are, Like for this whole past week or two, I felt like I had a low-grade fever. And when you have a fever, you feel lousy. Anyway, I'm embarrassed by my house. I don't even like having company. So it's like, what? I have nothing to bring to the table in a relationship. And I don't want to be a burden to anybody. I really don't want to. To be in a relationship with someone with fibromyalgia, it's a lot of burden. You can't do what you want to do. If you want to go to the movies, you can't do it. Like I said, I'm in bed at 8 o'clock. Now, if I stay up later than that, then I sleep later. So, it's like, it's not a nice syndrome. I wouldn't wish it on anybody. But I do want to get out there. There is help. There is help. This is a very nice thick book, 360 some odd pages. If you want more information, if you'd like me to read more from it, I will. Yes, temporomandibular joint. Do you have trouble swallowing? It's a very informative book. And this is the name of it. So, I don't even know when this book was written. Honestly, I actually stumbled upon it at a yard sale a few years back. I was like, wow. Because, there's only so much doctors can tell you, But I know with me, a lot of medications, I either don't react to them or I'm very sensitive to them. And especially with the Meniere's disease, it's very hard for me to take any type of medication. And I was on, at one point, 9 different medications. 9. 2 antidepressants, a muscle relaxer, a pain pill, my stomach pill, my heart pill. There were another 2. I just stopped taking them all at one point. I said, you know what? And then I found out the pain pill really wasn't working all that much. The antidepressants were actually making me depressed. So, I'm very sensitive to chemicals, so it's very hard for me to take anything, so I suffer. And I don't complain about it because why? Why complain about it? I get depressed when I complain about it. I don't even want to think about it. But I would like to help other people. So, if you're just being diagnosed with fibromyalgia and, I don't know, you want more information, let me know. I'll read more from the book. If you can't get it, if you can't afford to go buy it, I'll just read more for you. It doesn't bother me. I'm not doing anything else anyway. My dishes are waiting for me, but they're gonna wait. Yeah, that's another reason why I really don't want to be involved with anybody, because my house is a mess. It really is, and I don't even care anymore. I just don't care. I get no help, and people expect me to help them, and I do what I can to help, but whatever. Have a great day, everyone, and I will talk to you soon, I hope. Sorry for complaining at the end there, but it is what it is, and if you would like to hear more, let me know. Leave a comment, and I will read more for you. Have a good one. Bye.